Good afternoon, colleagues. I think it is good afternoon for most of you, but if it's good morning or it's good evening, then greetings of the time of the day to you, and a very warm welcome to this ICN-hosted webinar. We are delighted to be joined by national nursing associations from right across the continent of Africa, and also with the Nursing Now groups from a number of countries in Africa as well. And colleagues, I genuinely believe that this is a moment where Africa could be ahead of the game in terms of nursing and midwifery. And that's why we want to have this focus today on nursing and midwifery in the continent of Africa. And I make that bold claim about being ahead of the game because of the fantastic report that has been brought forward by ECSA colleagues, the Nursing Education and Workforce Labour Market Report, which provides us with a data-rich source of information about the nursing and midwifery professions on the continent. And I particularly want to acknowledge right at the start of this webinar that the report would not have been possible without the phenomenal support from the World Bank, colleagues, both still with the World Bank and who've recently left, who we're delighted to be joining us for this webinar this afternoon. Colleagues from JPIGO, the immediate past president of ICN, Judith Shamian, and of course colleagues from Exacon as well. The report enables us to have a policy-driven discussion based on very specific data about nursing and midwifery in Africa, but coupled with the State of the World's Nursing report that was produced last year as well. We want to explore the data, we want to explore the policy issues and how we align these to the new Strategic Directions for Nursing and Midwifery report that was unanimously agreed by all the countries at the World Health Assembly just a few weeks ago now in May. Colleagues, though, I do know that this is an incredibly difficult time for Africa, though, because of COVID. Cases are continuing to rise across the continent, and ICN has and continues to be extremely concerned about the inequity in access to vaccines for people and for health care workers. We have been doing a lot of work on this issue to bring attention to this issue. Just yesterday, a piece that we worked with the BBC on was broadcast across a whole range of BBC outlets, and one of my colleagues will put the link to that piece in the chat, in the chat function, so that you can access that as well. We had a contribution from a nurse from Zambia who you can hear in that piece as well. Whilst we know that 2.4 million healthcare workers on the continent have had one dose of the COVID vaccine, it's estimated that 66 million more doses are required just to ensure that all healthcare workers are double vaccinated. It's a moral imperative to act on this. It will protect and save lives of nurses and health workers, but it will save and protect others' lives and strengthen our health systems. And colleagues, if during this webinar in the chat function you want to tell us about the issues that are going on specifically for you and in the country that you join us from, please do let us know that. Colleagues, so without further ado, let me now pass to the ICN second Vice President, who is a phenomenal, respected, active advocate for nursing across the continent and a voice for Africa on the ICN board. Thembeka Gwagwa needs no introduction, but I will pass to her now for her opening remarks. Thembeka, to you.
Thank you very much, Howard. Can you hear me?
Yes, we hear you well, Thembeka.
Yes, I have already been disconnected twice. So there is really a problem of network. However, whilst you can still hear me, thank you very much for organizing this meeting. And like you have said, Africa, we do have what it takes as nurse leaders in this region to be ahead of the game. However, that will depend in the main on three things. Those three things being unity. I was so excited when I saw the invitation from ECSA, that is Lemi, being sent to the registrars and to the chief nursing officers. I said to myself, hallelujah. Because we can only, I want to repeat, succeed in lobbying for implementations of these recommendations if we as nurse leaders in our respective countries are able to put our differences aside and work together. So that was my excitement when I saw the invitations to registrars and the chief nursing officers. Because at a country level, we do have this challenge of not being able to work together. If something is being organized by ICN, people will say, in my country, it is an NNA that is a member of ICN, and therefore you will not be interested in the discussions that are going to take place. Thank you very much, ICN. And I always remember the former president of ICN, Judith Samei, when he said, there are many bubbles in this profession of ours, many. And I'm also excited that the Nursing Now groupings are here, because last time when I was invited to speak, I was cut off because I wanted to say these NA, they have added other bubbles within the bubbles that are already exist. So that is why I am saying, colleagues, nurse leaders, can we be able to work together? Can we be able to collaborate? Collaboration is key. Form partnership, because if we are to go to those in power that are to implement these recommendations, they will look at all of us as the members of the nation. How united are we in coming to them and say, this is what has come up from the study that was done. Thank you very much, Howard.
Thembeka, thank you so much for those opening words to highlight the opportunities that is before us, but the fact that we need to take that opportunity. It's down to us to action the opportunities that this report presents to us. And I'm now going to ask Erica Burton, the Senior Nursing Policy Advisor for ICN, who's intimately involved in the production of the report, to take us through the highlights from the report. Erica, the floor is yours.
Thanks so much, Howard. And hi, everyone. Good afternoon, good morning, good evening, perhaps. So I just want, Cyril, if we could put the slides on the screen, that'd be great. I just want to give a quick introduction to the report. I'm sure that most of you have seen it, and many of you will have read it, perhaps front to back, and maybe just the summary or the recommendations. We heard Thembeka say that collaboration is key, and this report really represents a true collaboration between partners. It comes from the pooled efforts of a very dedicated group of individuals, as Howard mentioned, at the World Bank, at Exacon, ICN, including past President Judith Shamian, and JPIGO. And then the study design also was in consultation with Exacon representatives. It has been an effort that has been ongoing for several years. Workshops were held in Nairobi in March 2018. And then for those of you in Singapore at the ICN Congress in 2019, you would have also seen presentations from Kama, who you'll hear from later, and from Judith as well. So a really big collaborative effort. Next slide, please. And the next slide, please. So the report presents a comprehensive assessment of the education and labor markets for nurses in the ECSA region. And it really documents the main challenges to train and deploy nurses, and then discusses opportunities for governments and the private sector, importantly, to overcome these challenges. It looks at the empirical evidence that was gathered in the region to support the expansion of nursing education. And then it focuses on private sector engagement and effective labor market regulation with the overarching lens of a regional collaboration. The report also describes the nursing education market, and that includes the makeup of education institutions and degree types. And then in the report, there are also 4 policy scenarios that look at expanding production of nurses to meet the needs-based demand. So that's 1, status quo, staying where you're at, 2, a 25% increase, a 50% increase, and a 75% increase. And then attached to those are a budget estimate to each scenario. And then it documents the positive return on investment in nursing education for the private individual and also for the public and all of society. So that's a very, very brief highlight of what the report aims were. And why this report was born was for a number of reasons. So if we're looking at the context a little bit, Sub-Saharan Africa specifically has had a very impressive period of economic development over the last 2 decades, which represents about a 300% growth rate of total GDP since 2000. Then concurrently, there was also a need to identify national and regional nursing education investment strategies. There was also a huge lack of health workforce data right away around the world, but similarly in Exacon countries. They were seeing both shortages and unemployment of nurses, and then this need for the nursing workforce to expand and contract in order to improve health system coverage, responsiveness, and efficiency. So this was the context. And then as, of course, the report or the study progressed, 2020 brought us the COVID-19 pandemic, which has profoundly affected everything that I've mentioned. And of course, the nursing education and practice spheres. And so throughout the report, you'll see evidence of the impact of COVID-19 as well, and how that fits into the analysis of the data and influences the recommendations. Next slide, please. So the report has data and evidence that has pointed to a number of recommendations that support the need to invest in nursing education and labor markets in the ECSA region. And that's probably not a surprise for everyone on this webinar. Investment is absolutely essential for a sufficient supply of nurses to achieve these big global health goals like universal health coverage, the Sustainable Development Goals, and to ensure healthy populations. The evidence in the report also shows that the region will need to increase the production and quality of pre-service nursing education and ensure that nurses entering the workforce are not only employed, but are allowed to work to their full scope of practice and are retained. And then this will also require investments in nursing governance, regulation, and production of data, and then analysis of this data. Next slide, please. So very, very quickly, the next few slides will go over the recommendations that came out of the report. And you may have gone right to this section. And so you might be familiar with these. You'll also see in the next presentation by the chief nurse of ICN that a lot of these overlap with the State of the World's Nursing Report and the strategic directions. So there's a lot of interplay between these recommendations. And many of the recommendations were related to governance and labor markets. So strengthening health workforce information systems and using the data, monitoring and effectively managing migration, and typically that's out migration from countries in the region. Strengthening the leadership role of the Quad in the country. And you will hear from a Quad representative from Zambia and how the Quad has really has huge influence in these recommendations and in the way forward. And improving accountability mechanisms for quality improvement. Next slide, please. Continuing in the governance and labor market spheres, creating policy frameworks that encourage the entrepreneurship of nurses. So really pushing forward innovation, building on existing regional models, of which there are many in the region, and planning and collaborating under these models. Very, very importantly, ensuring decent working conditions. We've obviously seen this as a huge influence during COVID-19 pandemic with lack of PPE and the mental and physical stress that nurses have been under. And this is important for retention. It's important for recruitment and to protect our precious resources, which is nurses. And then developing and strengthening the advanced practice or the APN role. And there's an educational piece that you'll see in the education section recommendations for that as well. Next slide, please. And then recommendations related to nursing education, targeting investments to institutions that are most critical for UHC and SDG attainment, emphasizing primary care, of course, primary health care being the cornerstone of universal health coverage and the sort of the future of health systems resilience. High quality transformative education models with strengthened regulation of nursing education. Next slide, please. And this is the last slide, addressing faculty shortages through, again, academic innovation, investment in nurse faculty programs, developing a regional curriculum framework for APN. So that's to strengthen this advanced practice role that we spoke of. Establishing a framework for public-private collaboration in advancing nursing education. And then finally, establishing a meaningful student loan program. So that was an extremely brief introduction to the report and a quick run through the recommendations. The real conversation is to be had with the panelists. So I will end there, but I really do encourage you, if you haven't done so already, to pick up the report, executive summary, recommendations, or front to back. Thank you so much.
Erica, thank you for that whistle-stop tour, but a comprehensive tour. And I would also really encourage you to look at the detail of the report and the data. There is some fantastic data in terms of progress that has been made, but also the potential that nursing holds to address healthcare needs, but also some real conundrums in terms of the scale of the needs-based shortage, whilst at the same time, we have nurses who are unable to find work. And it's because of some of these really challenging nitty-gritty issues that we want to now move and focus and think about policy recommendations and the policy response. And firstly, I'm delighted to introduce ICN's chief nurse, Michelle Acorn. She's just been with us for a couple of months now, but already feels a very, very established and key member of our team. And Michelle's going to talk to you a little bit about the global strategic directions of nursing and midwifery, which has recently been agreed. Michelle, the floor is yours.
Thank you so much, Howard. And I'm thrilled to be here with everybody today and connecting on this important webinar. I'm wondering if the slides could go back up. That would be fabulous to continue on this conversation. Erica beautifully gave a high-level review, but really there's significant synergy and alignment with these key global documents, not just the ECSA report, but of course, the State of the World Nursing Report, as well as the strategic directions and nursing and midwifery. I think with time and when these publications were developed, they continue to evolve and will inform us and reinforce as well. I read the report yesterday again for our conversations today, and I think I'd like to highlight a few things for you. Next slide, please. Thanks. You know that there's 4 pillars in the 4-year strategic directions for nursing and midwifery that will specifically focus on education, jobs, leadership, and service delivery. When we focus on education for enough competencies to meet population health for nurses and midwives, that's sentinel because they do need the requisite knowledge, skill, and judgment and competencies to meet health priorities. We need to align the levels of nursing education with our optimized roles within the health and our academic systems as well. And the goal is to optimize domestic production of our profession as well to meet, or let's go further and surpass our health system demands. If we design our education programs that are competency-based and meet quality standards, that will be key as well. And we also need to marry faculty to continue to educate our profession that actually have scholarship and leadership, as well as currently demonstrating clinical expertise in content area to meet our different healthcare system needs. When we look at jobs, I rather look at it as careers because nursing is a profession and a career, and meaningful work is important to manage migration and recruiting and retaining and the resilience of our workforce that is needed for sustaining ethical mobility and migration and service delivery as well. We need to look at workforce planning and forecasting and true adequate roles as nurses and midwives and how we respect that in delivering primary care across a healthcare system that's transforming and recovering from COVID as well. And more importantly, if we think about workforce planning, specifically, we're talking about Africa today is where they're most needed as well, which really showed some details in this report. When we look at strengthening leadership through our health systems and academic systems as well, we really need to think about placing nurses in both formal and informal leadership positions that we can inform the management of health policy and continuing to develop our leaders as well as looking at service delivery, maximizing and enabling our nurses to our full extent so that they can deliver health services and maximize their contributions in team as well. Next slide, please. The evidence and data to drive forward dialogue and decisions deliberately are key. And we know from our education and our national nursing associations have been stellar in giving us the information that we need, that there were major disruptions in our education system, which affects our supply. We have aging, maturing workforce with retirement. We have intention to leave as a result of COVID. As well as unsupported systems for decent working conditions as well that we need to really be mindful and considering. And we have great nursing IND fact sheets here to help support you in your decisions and that were supported in the report as well. Next slide, please. When we think about our health workforce and the profession of nursing, the nursing shortening, and now further impacted by COVID and the COVID effect. We really need to think about, there is opportunity as well, however, because as a result of this, there are increased enrollments in education as identified in the nursing surveys. However, we need to be mindful about increasing rates of intention and how we do this, as well as resourcing for adequate staffing, as well as considering mental health and wellness as well. So I urge you to really think about reviewing the statistics from IND and our NNAs especially as well. Next slide, please. Thank you. The report highlighted that countries need to invest in nursing education and labor markets. If we need data and forecasting that's reliable, that we can base our decisions for health workforce planning and the life cycle of our health workers. And that's from novice to expert. It's from early, mid, or later mature career nursing as well, across different sectors. So if we think about our countries, strengthening that capacity to collect the data, analyze it consistently across countries to be able to inform better, that will be imperative. When we look at mobility and migration and how we monitor this ethically will also be key, because we are a collective as well. And our education to graduate nurses who are going to progress primary healthcare and universal health coverage is going to be key across health systems and sectors as well, not just in, for example, hospitals, in home and community care, in long-term care or care of age as well. Next slide, please. When we look at 7 strategies to address nursing workforce shortages, and our panel will really think and dive into these with more deliberations, as we really need to think about reframing, and that's investing, maximizing, influencing, implementing, and sustaining. How do we actually invest in the nursing workforce and see that investing in nursing is growing the health and wealth of our nations? How do we stimulate the supply of nurses for meaningful value to work and keeping them in our countries, in our regions as well? How do we promote the individuals and more patient partnership or health literacy, so they're partners in their care and they're able to manage that more effectively and efficiently and competently? Next slide, please. When we equip our nurses, we need to ensure that they have the resources and technology and working conditions. We need to implement new models of care or adopt evidence-based care for nurse-led models or interprofessional models. We can enable nurses to work at their maximum scope, that they have the competencies and confidence to be able to help our populations and feel valued. And lastly, we can embrace the techniques and strategies and cultures that will help with retaining and ensuring that nurses are in that desired profession. And part of that culture could be just sensitive nursing workforce policies that actually enable working environments, managing flexible, manageable working conditions, and gender transformative leadership as well. Thank you. Back to you, Chair Howard.
Michelle, again, thank you so much for a really clear and concise presentation. I think, colleagues, what you can see emerging already is that there are some clear points of consensus and alignment across the recommendations from the ECSA report, from SDNM, but there are also some really important and unique differences. I mentioned the supply-demand gap, the issues around the opportunities for advanced practice and entrepreneurship are different as well, potentially. So this discussion that we now want to move into is to really think about how do we achieve change on the ground? What do we do to implement these recommendations specific to the context, the needs and demands in Africa? And I'm delighted to introduce my colleague, Susan Williams, who's going to chair a stellar panel for you. Susan has been working with us for a few months now, specifically to help with the transition of the Nursing Now groups into ICN. But for those of you who don't know as well, the ICN board recently took the decision that the strategic directions for nursing and midwifery strategy should absolutely be the focus and the priority of the work that we do, both with our Nursing Now groups and with our national nursing associations. Susan, over to you to lead us through the panel.
Thank you very much, Howard, and good afternoon to everyone. This session, as Howard said, is going to start looking much more at the nitty-gritty, what we can do in future based on the data, the evidence, the policy recommendations that are there. Also, what we can learn from what's been successful in the region already. But most importantly, and I thought that Tembeka set the tone from the very beginning for this webinar, is are there also things we can learn around collaboration? And I'm really keen that we have a little bit of time to understand a bit more the Quad and the experience that colleagues have had in the region of that, along with obviously welcoming those of you who've been involved in the Nursing Now groups, because it is so important that all of the nursing entities who have a stake in this work together. So first of all, I'm just going to introduce the three panelists, and then they'll all have about 5 minutes. I'll just remind them we did set them 3 questions, and they can answer all of them or 1 or 2 of them as they see fit. All 3 of them have been really involved in the development of the ECSA report, and we're really pleased to have them all with us here today. And the first is Karma Rogo, who until recently was lead health specialist at the World Bank, and I understand that you really have been a driving force along with the other partners in actually getting this report made and published, and what really good timing it's been for publishing it now as well. And our second speaker, panelist, is Kiogetse Kwabi, who is the president of Exacon, who I'm sure everyone in the region knows about, but Exacon is the Eastern, Southern, Central African College of Nursing, and has been promoting and strengthening excellence in nursing in the region since the 1990s, and was key to this report. And I'm also really pleased that we have Priska Sakala Mukonka, who's head of the Lusaka College of Nursing and Midwifery in Zambia, but also very importantly, and we're hoping she'll be able to speak a bit about this, she is part of one of these Quad groupings, part of the nurse educator pillar. And I think this is a really interesting model that I'm sure nursing organisations in other regions will also be interested in. So back to the panel. You've got about 5 minutes each, and if we have time at the end, we will take questions from those of you who are attending. If you want to post something in the Q&A section, if we get time, we will read out your questions and put them to the panel. And if not, this is not the end. We definitely will be doing some follow-up, more interactive work with the region. So how do we use all of this valuable work that's been done for the future? Are there things in the region that can be built on as successes? And how do we carry on monitoring as well how progress is being made? So first of all, over to you, Karma, and thank you very much for joining us today.
Thank you very much, Susan. I thank the nursing leadership in Africa and globally for giving me this opportunity. I was a proud member of the team that put this work together. And I'm confident that it is probably one of the best pieces on human resource ever put in my lifetime. One reason, this report belongs to you, the nurses of ECSA, of Africa, and of this world. The findings are yours, the recommendation It does not belong to the World Bank or JAPIGO or anybody else. 2, the recommendations are all doable. There's lots of low-hanging fruits that you can pluck. There are short and long-term things, but all of them must start now, must start yesterday, and not tomorrow. Most important is that the recommendations are good for all people interested in UHC, be they nurses themselves, be they other sectoral workers, be they patients or governments. But most important is that this report and this recommendation is even more relevant now with COVID than it would have been before COVID. I say so because COVID irresponsibility is killing more nurses than any other cadre in health globally. And I need to repeat that. COVID irresponsibility is killing and will continue to kill more nurses than any other cadre. Here in Kenya, I know that the data that we already have shows that the number of nurses lost are multiples of the numbers of physicians lost. Not less than 5 times, but much more than that. Most important too, the quality of this report is such that if it was a report on any other cadre or any other profession globally, it would have been a headline in The Economist, in Time magazine, and all the global papers. But because it is nurses, it is still being whispered and is being spoken to with a whimper. That worries me. Most important is that if we are to move forward, each country, each nursing group, each nursing leader must encourage the development of a smart objective for implementation at the level at which they are leading. Smart that the actions must be clear, implementable, measurable, and accountable. I'd like to see that in every ECSA country and every other country that does this. Without that, we are going to go through the same disappointments. But if that were to happen, then what is it that we have to put together? I want to bring in at the center of this discussion the role of the Quad. Quad, and Quad. I believe that for our region, and not only that, for the globe, the members of the Quad must be the leaders that their titles give them. That title gives them the leadership of nursing as a chief nursing officer in the country, as a president of the Nursing Association, as a professor in academics of nursing, and as a registrar of the Nursing Council. You don't get much higher than that. So if these people can't lead when there is such a clear report with actions that are so easy and low-hanging, then I think we have to reframe the discussion of leadership. I want to believe that this is where our Waterloo is gonna be for this report. Sadly, I don't feel confident because for me, Quad was supposed to define inclusive leadership, collaborative leadership, because that is what it will take for us to get nursing beyond what this report gives you. The question, and Kogetse and Demek and all of you are here raised. Does ECSA region, does the nursing leadership in Africa have confidence that the Quad concept can be applied and applied forcefully to carry us through the implementation of these recommendations? I believe that modern war definitely could be won without an infantry. But it's usually unsustainable victory. And the infantry in health, in UHC, the infantry, the boots on the ground are the nurses. We forget them and there is no UHC. We forget UHC, then it means that the Quad will not have the impact that it should. I repeat, the best report I've ever seen on human resource in my lifetime is this one. I'm proud that it's coming from my region. I'm confident that individually we have nurse leaders. Collectively as a Quad, I want to put it as a challenge that we must do it. Otherwise, it will just be yet another report that finds dust accumulating it on the shelves of our offices. Thank you.
Thank you very much, Karma, and that's really, really set us off here. That was a rallying cry for the fact that the report offers so much to us, but also a challenge back to the nursing community and particularly nursing leadership in the region to make this into something that they can work together on, because without that, it won't happen. So I'm going to move on to our second panelist, and that's Kyogatse Kwabi from Exacon, where obviously there's been a lot of regional collaboration over the years on many issues, including regulation. And Kyogatse, we'd like to hear your view about how this report can be taken forward, but also if you wanted to come back, please, and take on the challenge that Karma has put before us all.
Thank you, Susan. Good morning, good afternoon, good evening. Can you hear me? Thank you so much. Let me also maybe start by making an apology in case you may hear a lot of noise behind me here. There's construction going on, but I hope it won't disturb us so much. I'm very delighted this afternoon to be taking part in this very important webinar. More so that immediately after the launch of the study, there were a lot of questions coming forth like, yes, here is the report, so what? What next? And it wasn't easy to answer the question of what next. But let me just briefly start by giving a small structure of Exacon so that people can have an idea of how we operate and the role of Exacon in relation to nursing and midwifery issues. So what happens is that at Exacon we have what we call the Council of National Representatives. This Council of National Representatives is comprised of the executive and the four faculties of Exacon. We have a faculty of education, faculty of research, faculty of clinical practice, and faculty of leadership and management. So these faculties, they have chairmen. So what happens is at Exacon, we work through these faculties. I think, let me also say, this is where the Quad is coming from. We have the regulatory bodies, we have the NNAs, we have the chief nursing officers, and we have people from the education sector. So this has coming together form what we call the Quad. So what happens is when there is an activity to be done, we look at which faculty it falls under. So after the release of the report, we looked at the report. After contributing to it, then we said, then what? But let me also make the audience here understand that as Exacon, we are not actually the implementers in the countries. we are advisors to the Ministries of Health and Education, where nursing is controlled. So this study made us now to stand and say, now we have a evidence-based research, evidence-based information that the ministries can use. When we talk to them to say there's shortage of nurses, when we talk to them to say there's migration of nurses, when we talk to them to say the nurses are working under poor conditions, sometimes it doesn't make sense to the leaders. But with this report, we are confident that now we can show them that this is what we have been talking about. It's just unfortunate to say we may produce the reports, but implementation is not within our powers. But what we do is through the course that have been mentioned, that's how we reach our ministries. We reach the ministry mainly in two ways. The first way, we are privileged and advantaged to attend the health ministers' conferences, which are annual events. And at the health ministers' conferences, we are given a chance to talk to the ministers directly or their representatives. But unfortunately, like I've mentioned before, some countries are not represented at the health ministers' conferences because they are not members. Second, where we reach to our ministers is through the Quad, but mainly we work through the office of the chief nursing officers or the directors of nursing. That is, we communicate with them and then they call together the members of the Quad. That after calling together the members of the Quad, that's when now they take whatever information to the permanent secretaries of the ministries involved. So when the Quad are working together, you will find that all information will reach the designated places. So with this study, you can remember well that before we launched, we invited all health ministers, and we were fortunate to have the Minister of Health to launch it, a Minister of Health for Eswatini. We hope that she will share with her colleagues in her capacity as well. So inviting them was meant to make them understand and get the information from all the partners that were involved in the study, because all of us during that launch, we had something to say. And those who attended, I can say they managed to get first-hand information from the report. So what next comes here? I'm worried, I'm concerned by the fact that, you know, even with the State of the World Nursing Report, which the ministers attended very well at the World Health Assembly and agreed to support it, but I'm still asking myself, what next? Because they have the information. And this report, like the previous presenter has shown, that the report that we are talking about now and the State of the World Health Nursing Report, they are more or less pointing at the same direction. But the ministers or the ministries concerned, have they taken any action on the State of the World Health Nursing Report? Because if they have not taken any action, it worries me that are they going to take action in this report? Because for me, they provide the same information. But with us at Exacon, what we try to do is to push the recommendations of the report. But it's unfortunate that we push it through other people, like I have said, we push it through the offices of the directors and chief nursing officers in conjunction with the quads in the countries. And my prayer is that I wish all the quads should be working together. But unfortunately, here and there, I understand that in some countries, the quads are not so solid like in others. But where the quad is solid, we take it that the information that we share with them always go there. But we have also another responsibility in our own small way. We have partners who are helping us. For example, if I give an example regarding education, we are not only relying on the ministries. As a College of Nurses and Midwives, we also join with partners to do some things like, for example, right now we are in collaboration or in discussion with some partners like we did a tool with AMREF, which was meant to track migration of nurses and midwives in the ECSA region. Though we haven't yet started reporting, but the tool was designed and shared. So it's just unfortunate that we have not yet started reporting, but the aim was to report migration of nurses in the region. We are also working with JAPIGO right now on the pre-service education of nurses and midwives to see what we can share with the ministries at the end of that landscape. And we are also liaising and looking here and there for partners to work with to educate nurses, especially with issues of CPD, that is to improve their knowledge on what they already know. So with CPD, we are working with other partners. I won't mention them because we are still discussing, but we have about 5 areas right now that we are discussing to improve the nursing and midwifery in our region. So far, what I'm trying to say here is, as much as we expect the governments to do something on education and labor markets, as Exacon also, we have our own small way where we are also doing the part that we can do. So like it has been said earlier, so far where we are hopeful that with ICN, our leaders will be able to get what nursing is all about. We still feel that as much as we make a lot of noise, as much as we are talking to be recognized, it's not all countries that are taking us or that have taken us where we want to be. We still have countries in the ECSA region which do not have directors of nursing. But we have said, how do we expect nurses to deliver if they are not involved in decision-making where nursing where nursing is involved? So we are saying, can we have nurses at that policy-making, decision-making level, which unfortunately, with some countries, yes, with others, we are not yet there. But we continue to talk on leadership and management of nursing. So that is what I can share with you so far. I think maybe I can give a next. Okay, thank you so much.
Thank you very much, Karageta. I'm just aware we're running a bit over, and I did want to give Priska an opportunity just briefly, because it's very important. You've just made the point that there's so much you can do in influencing ministers, but there's also things that you as a college are able to do directly yourself, and being able to make that difference between the two is really important. So very briefly, just to finish, I'm going to ask Priska if she can just think a little bit about her experience of being part of a quad and what she would recommend going forward in terms of using that experience to get some of these recommendations agreed. So what can the quad do itself from her experience, particularly in relation to nurse education?
Good afternoon and good morning, depending on the areas where we are. Are you able to get me? Okay, yeah, so I've called my presentation as the quad and the implementation of the reports. That's the 2 reports and the Zambian perspective to that. So Zambia has been implementing the quad activities since 2012. the country participated in the initial ARC projects and initiated the CPD for the renewal of licenses. And since then, the four arms of the four pillars of the Quad have been working together. Of course, there could have been a few challenges here and there, but mainly a lot of things have been achieved through that. So the main aim of the Quad is to harmonize working relationship of the nursing and midwifery leadership at country level and provide direction in nursing and midwifery education and practice. And when we look at Zambia, we have since 2016, Zambia has been implementing the activities of, or if we say the SDG, the strategic directions for the nursing and midwifery, looking at the activities that have been taking place. And since the Ministry of Health have been saying that we have to have a transformation in the way we carry out activities, and that include also the nursing and midwifery practice. So the Quad, from the time it was established, we've been working together in consultation and also making collective decisions. That's relating to nursing and midwifery. That's under these areas like education, clinical practice, leadership, and also research. Though research hasn't been too good or too well, I think we still need to do a lot in terms of research. And but then when we look at the WHO Global Strategic Directions for Nursing and Midwifery and the reports for the ECSA nursing education, we see that the government of Zambia since 2016 launched a paradigm shift in the health sector in the achievement for the universal health coverage. And this is through the high level of commitment to the transformative agenda. And we see that the nursing and midwifery fraternity actually has been alive to this. And as we all know that the universal health coverage cannot be achieved without the involvement of nurses. And this is all the three areas of nursing. So we have, like, looking at the four pillars. I've divided my presentation looking at the four pillars of the strategic directions. And when we look at the education, we see that the Quad, working together and collaborating, have achieved a number of successes in that area. And we see that there's the Quad has developed and reviewed different competence-based curricula for nursing and midwifery programs. And have also launched the same curricula to strengthen the MOH transformative agenda through the PHC approach and also to improve the services. And this has been driven by the disease burden and also the health needs of the Zambian community. A number of curricula have been developed. We see like the pre-service public health nursing. These also, these are nurses who are going to be community-based. Oncology, before that, we never had nurses. in oncology, they used to train outside. We also have now the pre-service pediatric and child health nursing, and the critical care nursing. We've had critical care nursing like since 2012, but this was at diploma. But then this is being escalated to a bachelor's degree right now, and also there are also plans to do it at the master's level. But we also see that especially during this time of COVID-19 pandemic, critical care nursing have become like diamond, and in Zambia we don't have a lot of that. So the pandemic has really taught us that we need to train more nurses in critical care nursing. But also like emergency and trauma nursing in Zambia, this never was there. And we saw that like in Zambia, emergencies would be out there on the road, but when they come to the hospital, they would come like become like normal cases. So it was important that a curriculum on emergency and trauma nursing should be developed. And this we have developed as the Quad, and is actually being implemented for the past 3 years now. And also direct midwifery, of course, to look at the, to keep the high maternal and mortality rates, and also neonatal nursing. This curricula has also been developed by the Quad, of course, and is supposed to be implemented this year. Then the COVID response for nursing and the midwifery. Again, this we are looking into that. And then also a number of curricula have been reviewed, the midwifery, the HIV nurse practitioner. We also have clinical instructor nursing, because in education, you also have to have somebody in the clinical area. Before that, in Zambia, nurses, students used to be mentored just by nurses on the wards. There was never a formal training for the people that would do educate or carry out procedures or nursing for the students in the clinical area. But this course has been running in Zambia. At first it was on distance, but now it's based at, it's regular. And so we see a lot of people being nurses and midwives coming through, though the numbers are not very high. But after the training, we see these people that, yes, they've gotten this education and they are there in the clinical area, giving quality education to our students. And one great achievement has been the development of a disability module and the incorporation of the sign language into the nursing curricula. Because before that, sign language and our people that were like deaf and dumb, they were disadvantaged, and nurses had no idea on how to communicate with the type of people. But now we see that this curriculum has been incorporated, and the lecturers. Yes,
Priska, I'm really sorry. We only had an hour for the webinar today, and this is not the end of the discussion that we're going to have about these issues, and particularly about the Quad. You've given us a really good snapshot on the education side around some of the things that the Quad's achieved, and we certainly won't want to lose some of the other things that you would have wanted to talk to us about, but we are going to do some follow-up work after this webinar. So I'm really sorry to cut you short, but I know we will start to lose participants shortly because we set aside only an hour for this. So it's clear we would not be able to do justice to all the work that's going on and that needs to go on in this 1 hour. And we definitely will be coming back to this in a more interactive format as well. So I just wanted to say a really big thank you to you and to Karma and to Kegatse for contributing to the panel. And I'm going to hand back to Howard for some closing remarks. So really sorry I had to cut you off.
No, that's fine. Thank you.
Thanks everyone. It's our fault. We should have booked longer, but there will be more opportunities. We will do more. Tembeka, I'm gonna come to you in just a sec for a final comment. Let me please also just add my thanks to our fantastic panelists. Karma said it was the best HR report he's led in his lifetime. I have no doubt that is in large part down to his commitment, his dedication, his drive, his energy for these issues. We're indebted to you, Karma, and I think we all know if we don't take this forward, we'll have you to answer to, which is real motivation to us all. And Kigatsu and Priska, honestly, I think that you have set a model for the world in relation to what you've done through the Quads. I think that the Quads gives us so much learning for what we need to do as a nursing community, whether we find ourselves in education, regulation, associations, nursing now groups, or a chief nursing officer. And we're equally indebted to both of you and your colleagues as well. Tembeka, let me just come back to you now for a final closing comment. Tembeka, to you.
Thank you, Howard, and thank you to the panelists and to those that give a report. Thank you very much, Howard. You know, when I think of what has been happening between ICN and the nurse leaders in Africa, I kind of say thank you to COVID, really, because COVID has made us see the need of working together, irrespective of where you are, irrespective of whether you are coming from the so-called developed and the so-called developing countries. But at the end of the day, we are all nurses. We need to work together. And thank you, ICN, for doing that consistently. We even see you, Howard, even in our televisions, lobbying for nurses to get what they deserve. Now, for those who give report, I think the report was clear. There is nothing that needs to be interpreted. Everything is on us at a country level. Clearly, Dr. Kama, oh, thank you so much. And when Zambia, I wish you could share a lot on how do sustain, how to make sure that the quad you pull together, because it is really a challenge that we even observed even when the study was being done. So you really need to share a lot. And to Exacon, thank you. Probably we need to do things differently, but that is subject for discussion for another day. Thank you very much for everybody. I was also going through the questions and say, I hope we are all going to go back in our respective countries and take the discussion further. That's not the end of the day. Once more, thank you very much to everybody.
Tembeka, thank you. Colleagues, a number of you have been asking whether you can, whether we'll share the presentations and the comments and the feedback. Yes, we will. We've created a special place on our website where you'll be able to get the recordings, materials, presentations, and for the Nursing Now groups, all of our engagement work with you, you'll be able to access it through this page on our website, or contact us directly through that email address, and expect to hear more from us in the not too distant future. I'm sorry we've run over a few minutes, but thank you to all of you for joining us. Thank you for all that you are doing for nursing, and we look forward to continuing to work with you and ensure that this report makes the impact that it needs to and it deserves on the ground in Africa. Thanks everyone, take care and goodbye.
Bye.